Good evening, and thank you so much for joining us on this episode of Family Matters. It's actually a happy new year. We had taken a break courtesy of the Chan matches that were being aired live at KBC. So welcome to this program on this Valentine's Day. And the best gift to you, our viewer, is just to remind you on some of the precautions that you ought to take to protect yourselves and your loved ones from COVID-19, because it's still around. The country so far has over 102,000 cases of COVID-19 and over 1,700 deaths. In the world, we're talking about over 200 million cases and 2.4 million deaths courtesy of COVID-19. So which way? The COVID-19 has silenced the world without doubt. CDC, Center for Disease Control, is advising countries to work harder and ensure that they flatten our curve. And what we are seeing in the country is have we flattened our curve, and what are some of the precautions that have helped the country get to the 2.4% positivity rate? To just unpack all this is Gamaliel Omondi. Thank you so much, sir. Happy New Year. It's good to see you this year, and thank you for coming to this program tonight.
Thank you very much, Purity, and happy Valentine.
Thank you.
Yeah, to begin with, I think it would be good to tell viewers how we celebrated our Valentine today.
Sure.
And it was very wonderful today because looking at the origin of the Valentine, it started from Christian life in a Catholic Church in Rome. And today we had a wonderful church service where we were bidding farewell to our retired Archbishop. And I saw the mercy of God, and gifts were coming. Everything was there. We enjoyed. And I think it was wonderful for families of Christian life to reunite as Christians. Yes.
All right. And for me, I was just, of course, around with my family, part of my family that I'm with around here, and at work.
Okay, that is also wonderful, but we would encourage people that the church service brings families together, and it would be the wonderful way of celebrating Valentine going into the future.
And today, you know, it was on a Sunday.
Yes,
coincidentally.
Coincidentally.
You know, Gamaliel, you're so passionate about the preventive measures on COVID-19. You always walk around with the sanitizers, and I remember when you told me it was important to remind Kenyans that COVID-19 was still around and how to stay safe. Was it, as a healthcare worker who is on the front line to sensitize Kenyans on how to protect themselves, 11 months on, we are less than a month shy to also commemorating 1 year since Kenya reported the first case of COVID-19. Would you say these measures, Omondi, have helped?
Definitely, Purity, we have seen a lot of good efforts put by the government. And in terms of the measures that we put in place globally and locally, we have seen wonderful results. For example, let me just say that when we were trying to prevent COVID-19, we have realized that we have also prevented quite a number of respiratory diseases. For example, by using the masks, which I will demonstrate in a short while, people who are having allergies due to dust and all other things were now free of these diseases. When we come back to hand washing, a great effort has been made to curtail the diarrheal diseases that has bogged the healthcare systems over the years. Even though public health has been struggling to tell people to wash their hands, but with the coming of COVID-19 last year, many have practiced hand washing and use of sanitizers, and we have seen a remarkable reduction of diarrheal infections and upper respiratory tract infection due to use of masks. Yes.
All right. Well, we can say coronavirus is a necessary evil.
It is unnecessary even because it has unmasked the real public health that we really need to preach about. Because we always say that prevention is better than cure. The cost of hand washing is minimal compared to the cost of going to isolation ward, maybe to be under ventilator and to be under some medication of a viral disease that may not be treated. So what is being managed is opportunistic infections. And most of these opportunistic infections are always in the environment. If we manage well our environment, we keep hygiene for ourselves, and we stay safe, I think we would be making strides in Kenya. Yes.
Looking at where we are coming from, when the ministry was struggling, not just to tell Kenyans you need to put on a mask, but to even convince them that coronavirus do exist. Would you say as a ministry you've succeeded in, convincing Kenyans that COVID-19 is around, of course, because we've had family members or we know people with corona, but ensure that they follow these protocols?
Yeah, Purity, we have tried convincing, but going by health education and behavior change. The understanding of individuals are different. There are people who would pick the measures very quickly and work with them. There are people who would want to sit back and wait. And sometimes there are people who also fall back to religion. But the best thing to do is to combine religion and preventive measures that the government has put in place. And in that, I think, for us, we have seen a remarkable achievement. Even though a few people were being compelled to put on the masks because they did not understand why, because of lack of maybe education. But after going through the whole country trying to health educate people, they understood. And so the forceful way of making sure people follow the measures reduced a bit. People could practice willingly and voluntarily. But still we cannot say that we have had 100% success, because we are in a society with different levels of understanding of people. But 80% of the population, I think, embraced the measures and tried to practice them, especially when the lockdown was uplifted. And so people saw how ravaging the COVID-19 became. At that time is where now they realized COVID-19 is real, and they needed to start putting on or using the measures given. And people were hand washing, people were putting on masks, and others were trying to maintain social distance.
And as we speak, are Kenyans following these protocols, or how would you rate us?
As we speak, I think with the reopening of the economy, people imagined that things have gone down, and so people went back somehow to their normal life. But we have always said that it is not the normal, but it is the new normal. That we resume, but with our guidelines, with our protocols in place, and with our measures still being upheld and implemented. So to some, they are still saying that, okay, this thing has gone. To some, they are saying it is still there, we need to use measures. But as a government, we have not relaxed in our efforts to ensure that the general public is safe. Yes, and we have emphasized that even if we are talking of vaccines today, they are yet to come, but they are not the solution. The solution is preventive measures that have been put in place, keeping social distance, hand washing or hand sanitizing, and use of masks. Yes.
And as we speak, we're seeing our curve is, today it was at 2.45%. So it's easy for Kenyans to say there is no coronavirus, looking at the numbers that we've been recorded,
Our rate has gone slightly down based on those 11 months that we have experienced. But do remember also that we started with one case, and that one case was significant. So that 2% still remains significant to the Kenyan population. And we cannot say we are at 2%, we throw away the measures that we have. We still need to carry on with the measures and strictly observe the measures, strictly observe the guidelines that have been developed by the ministry. I think now we have like 86 guidelines and protocols that people can easily access at the ministerial website and read. especially those at the community level. And with regard to the use of masks, they are well defined there. Yes.
And Gamaliel, how do you explain this? When COVID first hit the country in March, the curve was going really quite faster, going up until July, and then we saw our curve going down, and then somewhere in October, November, we experienced what the Minister of Health termed the second wave. And now the numbers are going down, and we even saw health experts saying the numbers may be higher after the festive season. They're still going down. Would you attribute what is happening, you know, the shifting of the curve to the protocols? When people follow these COVID protocols, that the numbers go down. When they disregard them, that the numbers go up.
Yeah, thank you, Purity. As I explained earlier, when the first case was reported, the Kenyan health system was struggling to enhance the system itself by putting in place the necessary infrastructure to manage the pandemic. Now, we managed it to the level that the lockdown was uplifted. When now the lockdown was uplifted, people assumed and went back into their normal behaviors. And that is where now you could see a rise in the rates of infection. Then this rise continued slightly as the systems were also being strengthened, and that is when we moved again to the home-based care. Because most of our patients, let me say so, and those who are positive were asymptomatic. Asymptomatic could easily spread it if left like that. They are not showing any signs, they are not indicating any sickness in their bodies, but they had the virus. So these people had to be taken somewhere at the home-based care, and now the healthcare systems were relieved slightly of the patients. Then the intensified guidelines at the home-based care also now helped greatly to contain those who are positive, and in that case now the people were managed in situ. So that contributed to the reduction that we are now seeing today as we speak. And we believe that with the measures in place, and as we continue obeying the guidelines and practicing them, then we may be lucky to maintain the 2% and slightly move to zero. Yeah, because occasionally we have reported 0 deaths, like yesterday we had 1 death. Today we had 0. The day before yesterday was also 0. Yeah. We are hoping that we will be reaching a place where, or a time where we will report 0, 0, 0 and very minimal cases. But again, Purity, when we look at the disease, the new diseases as they come into being, human body also behaves in a queer manner, queer in the sense that we develop immunity. So could be there were many people who have come into contact with this disease and have also recovered, because most of our people have recovered. So that could also contribute to reduction, because many of us could have developed this herd immunity. Yes.
The behavior of Kenyans, you said that when Kenyans began to disregard the protocols at around in the beginning of the pandemic, that's when we were experiencing the curve going up. But then when they took this seriously, it was going down, and a second wave and the cycle. Are we looking forward to another wave of coronavirus, looking at what is happening? I know, please begin by pointing out, if I'm not wrong, I don't think we are really holding tight to these protocols currently.
Yeah, I think that is what I want to emphasize to Kenyans, that we should not drop the guidelines and the protocols and the measures put in place at the expense of just saying we have 2% or 4% or 3%. That would be detrimental to us. Even as we go towards 2%, we should maintain the measures that were put in place. Simply because if we relax, and we have heard that the virus is also changing every other day, we could be having a more dangerous and another species that could spread very quickly in the environment or among human population. And we can either shoot or go down. So if we don't follow the measures that we have, that would be the scenario. So I would want to urge Kenyans that let us not drop the measures that we have put in place, the hand washing with soap, sanitizing with sanitizer, use of mask whenever we are in crowded places is very important. And even when we are in a room with more than 5 to 6 people where ventilation is not adequate and we are people of different origin, then we should ensure that we are having our masks on. Yes.
Let's pick it up from the putting on the mask.
Yes.
You've mentioned when we are maybe in enclosed places, when you are near people. So when do we use masks? Because sometimes it's really uncomfortable. That means you do not have to use a mask if you are alone in an open space?
Yes, if you are alone in an open space, you don't need to use a mask because you are alone. There is no threat, there is no risk around you if that environment is safe also. If you are 3 or 4 people, because we do not know who could be asymptomatic, that requires that we have to put on our masks. But now that we are sitting with you, we are 2 and we are keeping social distance, we can still say we are safe. Yes, so we can put our masks down, but immediately we congregate 5 of us where we cannot keep social distance, then we insist we have to put on our masks. Yes.
Between March and now, we have Gamaliel over, let's say, even 1,000 types of masks being sold in the market right now. And I know you're very categorical when it comes to the proper usage of masks. Do we, as the Minister of Health, have you been able to identify which ones are not fit for use as far as coronavirus is concerned? Or because the last time I spoke with you, you were emphasizing on the surgical mask, the N95, and also the cloth mask.
Yeah, the N95 is very good, and it can save up to 95% the way the name suggests. Surgical mask can move between 65 to 70% in prevention of infection. Then the cloth face covering, which is this one, if it has got 2 layers and is made of cotton, it could even be better than the surgical mask because it could move to 80%. Only if it has got cotton with 2 layers. It would be the best for the community to use. For these 2, we are preserving them for the health sector, those who are seeing the patients in isolation wards.
Maybe we can revisit on the usage of the mask, because I know you've been complaining and urging Kenyans not to always put their masks under the chin. Let's remind one another on how to properly use the mask.
Yes.
What you need to do before and after using the mask. Do you need to wash your hands first?
Yes.
Do you need to sanitize?
Yes, before you pick the mask that you want to use, then you need to use a sanitizer, the hand sanitizer, which I think I carried mine here.
So that's just to clear any germs in case
Yes, just to clear the germs. And you should do it properly all through to make sure that everything is clear. In the event that you are at the community level and you don't have the sanitizer, then you could use running water and soap. It will still deal with the COVID-19 virus effectively well. Then after doing that, you are supposed to pick your surgical mask or cloth face covering, whichever you have. And then you need to check very well the colored side should be the outside part, and the white side should be the inner part. Then on top here we have a strip which should be holding the nose tightly.
So why do we have to ensure that the colored part is on the outer side?
Yeah, because this mask is in triple, it has got 3 layers.
Okay.
So the outer layer is what we call hydrophilic. It repels water and moisture and any droplet from outside. The inner layer is hydrophobic. It absorbs what comes from my mouth. And the medium layer is the filter that now filters the viruses and all that. So then that is why it is important that you use the right color so that you get the layers appropriately the way I've explained. So it should never be used vice versa.
So when you use vice versa, then you'll not be able to, like for example, absorb the fluids that are coming from your mouth with the white part.
Yes, if you do vice versa, then it means this one which should absorb will absorb from outside and filter. Then this
from inside.
Yes. So you just retain the colors the way they are.
All right.
So after making sure that your hands are sanitized, you have identified the upper or the nose strip, then you put it carefully, adjust to fit, and squeeze a bit to hold it fast on the nose. Then make sure that there is no opening on the sides, because it can still absorb droplets. So you make sure that you adjust that every part is covered properly. Then you can stay with it. I know now Kenyans are used to staying with it. But there are a few don'ts that we need to still emphasize on, that when you put it on like that. When you want to remove it, please just remove it like this. Do not handle the outer surface, and place it on, if you have a cleaner surface like a serviette, like a tissue, you can rest it somewhere. Take your water, take your meals, and then put it on again. So
there's no putting it on in your pocket?
There is no, it is not safe for you to put it on the pocket, because you will be having chances of getting contaminated if anything was on this surface. Yes. And there are other behaviors that I also need to discourage right away.
Right.
Like you are putting it like this, then you pull it to your chin. That is not allowed, because already you are contaminating the neck and your dressings and everything. So you need just to remove it very well. Another one is hanging it like that isn't allowed.
Okay.
So you need to handle it effectively well for it also to support or protect you from diseases. Yes.
Sometimes it can be uncomfortable when you're putting it on and you're saying you have to ensure that there are no gaps. So how do you breathe? Because those are some of the reasons that make people maybe put it under their chin or even inside their pockets.
I think purity, the way the mask is made, it is made to enable you to breathe, even when you put it on, either tightly or, yes. So when you adjust it properly, you test it if you are able to breathe, and you will just breathe comfortably. Everything is done, and continuously, if you use it, you will still just find that you are able to use it. Myself, for the first time, I had it very difficult, but I'm used to it now. I put it on every other day.
Why I'm saying so, I always find it uncomfortable, especially when I try putting on the cloth mask, because it's a bit thick and therefore you're struggling to breathe,
Yes, but how many times are you in a public place where you cannot keep social distance?
Most of the time.
Most of the time.
Yeah.
So then you can use the surgical mask for you. But also this face covering can also be used. You only need to adapt to it. And you only need to ensure that your social distance is safe, and then you can remove it the way today we are talking. Yes, you can have people here who are concentrated here, but they are keeping 1.5 meters social distance. You could be safer. Yeah, but we are not saying again that a mask is a substitute of social distance. It is not. We should employ all these measures collectively. Yes.
And for the surgical masks and the cloth, maybe how do you clean them?
For surgical mask, it is single use, and once you use it, I think it is supposed to be disposed of. I see some people using it 2 or 3 times. Yeah, but it should be disposed of after every single use. For the cloth face covering, you are supposed to wash it. And you can always wash it after every 24 hours or 12 hours after use. Now, which means you should have either 2, so that when one is washed, one can be used. And you wash it with hot water and soap. Then you air it in an open place where the sun is, so that after 8 hours like this, it will be dry under the sun, because the sun is also germicidal. It kills germs. Yeah. So that is for this one. But then this can be used repeatedly until you see it is torn or it has stains, then you can dispose of it safely.
All right.
Yeah.
Who is supposed to put on the mask in terms of the age group? Because of, I'm sure we've all seen parents walking around with their kids. The parents are putting on the mask, but the kids do not have the masks on.
Yeah, the kids who are 5 years of age and below, it's not recommended for them to put on the mask because, for one, they cannot manage it themselves. Yeah, and they could still have difficulties in breathing, and their systems are still very weak. So it is always recommended that we also keep them away from the crowd. We try to keep them away from people and those occasions where people can come together, and with their mothers or their fathers if they are working together. Where we have overcrowding and we have the parents, maybe they can be able to check who really deserves, because we also have children who are 5 years and below but are having comorbidities, and we know COVID-19 and comorbidities, so then we need to protect these children. At such circumstances, then a medical personnel will advise on how this child should be taken care of while in the public.
All right.
Now, 6 to going forward to around 11 is supposed to use the mask. And the few who can use the mask under strict instruction of a medical personnel are those who are also immunocompromised or have got comorbidities. Those ones must be advised and must be checked regularly. Then the young ones, these ones can also rely on their parents to be advising on how to use those masks. Yes. And
initially it was easy to keep children at home. Right now schools are open and the age groups that we are discussing are supposed to put on the masks. So how best should teachers ensure that these children who is hard to control stick to these rules, especially on the mask?
Well, I think there are those that go to school routinely from home, but there are those that are in boarding schools, and when they went, I think they were all advised to have their masks. What was discouraged was the sanitizer, because we knew that there was adequate water and soap. These are also dangerous. Sanitizers are alcohol-based and may not be allowed in schools. You have seen a lot of things happening in schools, and this could contribute. So the teachers were trained on how to handle their students. And actually before that, the protocols and guidelines for reopening of schools were developed. These guidelines explain precisely how children are supposed to behave while in school up to the time they come back at home. And so far, the guidelines are being implemented. A few cases were reported when the borders reported back, but now for the last 1 month, I think there is quietness in schools, meaning we are doing well with the reopening of schools guidelines. Yes.
All right, well said. The second way of protecting ourselves, according to the Minister of Health, the World Health Organization, and also CDC, is using the hand sanitizer. When and how is it used?
The hand sanitizer is supposed to be used as frequent as possible whenever you get into contact with a surface that you think could potentially be having droplets with the virus or with any biological organism. Then you need to use your sanitizer. Whenever you touch a surface, whenever you touch anything, before going to the next step, you need to hand sanitize. And hand sanitizing means you use a sanitizer, but you can also wash your hands with soap and water. Yeah, so it is something that is frequent, and this is something that even public health had been preaching all along when we were seeing these diarrheal diseases were taking toll on us. But people could not really adapt to hand washing. So then the COVID-19 has demonstrated clearly that true, hand washing and sanitizing can quickly reduce 60 to 80% of these infectious diseases. Yes.
So what's the proper usage of the hand sanitizer?
The hand sanitizer...
And maybe which ones are recommended? Do we have the recommended ones? Because some are usually, when you go to the shelves, you'll find 70% alcohol-based. Others are do not have such, verification. So maybe you can tell us which ones should you be going out for as far as preventing COVID-19 is concerned?
Yeah, for now we are basically stuck with the alcohol-based sanitizer, which is 70% alcohol. And that is what we have maintained for hand sanitizing. There are also chemicals that we are using for disinfection and cleaning of surfaces, which is also one of the most recommended measure for control of COVID. All surfaces that we work around should always be wiped and cleaned after every activity. Like for us, if we live here with all these things, we need to sanitize this table so that it does not cause any trouble. Cleaning of the surfaces, we have series of chemicals that are recommended, alcohol-based hand rub 0.05 is for the hand hygiene, then 0.5 is for disinfection. That is what is used now to clean the surfaces. We also have hydrogen peroxide, which we use. We also have isopropyl alcohol, which we use in cleaning the surfaces. But for hand sanitizing is this alcohol-based hand sanitizer, 70%. Yes.
And how do you go about hand sanitizing? I would be interested in knowing the quantity and how you rub those hands.
Yeah, you'll just pick it, and once you pick it, you pour a sufficient quantity which you think can help rub all your hands and all the spaces everywhere. So you make sure you have adequate. So
the spray sanitizers are a no?
No, they are not a no, because even the spray one, you would spray, but you spray adequately so that all the surfaces in your hands are covered. Yeah, because this sanitizer could be in a container that brings it out as a spray.
Okay.
Yes.
All right.
So you do it everywhere and ensure that every part of your hands are sanitized, including the...
So when is it used? Is it before maybe touching a surface, before removing the mask? When do we use the hand sanitizer?
Okay, when you want to
can you use it and eat with your bare hands? Those are the
not really.
Yeah.
When you want to put on your mask, you sanitize. When you are going to remove your mask, you sanitize. And when you have removed the mask, you also sanitize. Yeah, to make sure that you are leaving nothing to chance.
And if you have to touch your face?
Well. Once you sanitize, if you want to touch your face, then you are a little bit safer.
Okay.
Yeah, but we also discourage as much as possible during this period of pandemic that we avoid our hands going into our faces, nose and mouth. Yeah.
Sanitizing and washing of hands, you advocate for washing of hands if possible?
Yes, where we have adequate water and soap, we go for that. Where we don't have water and soap, we resort to sanitizer. Yes. So
you mentioned some of the, advantages that have come with washing of hands, and maybe you can bring us to speed on how these preventive measures, especially on sanitizing and washing hands, are helping in control of some of these diseases that we've been battling with as a country.
Yes, the quick one I've been talking about is diarrhea. And diarrhea in most cases is picked from hands to food to mouth. Then you get diarrhea from there. So if somebody went into the toilet and forgot to clean, then that person comes back maybe to prepare food for me and you, then we eat that food. However, if our hands are clean, but the person who went to the toilet never cleaned, dropped some elements of bacteria in the food. So that is how we end up getting the diarrhea. And with the frequent hand washing and sanitizing, we have seen a remarkable reduction in these diarrheal infections. And that is why we are encouraging people that even after COVID, we sustain the issue of hand washing, we sustain the issue of hand sanitizing. It will prevent 60 to 80% of communicable diseases. Yes.
So the health officials are saying that we must follow these protocols. And just before I ask you this question, apart from hand washing and sanitizing and putting on the mask and socially distancing, do we have other revised ways of preventing ourselves or protocols that I may not be aware of?
Yeah, the protocols and guidelines developed revolve around those 4 measures. The hand sanitizing, putting on of the mask, social distancing. I think there are 3. Yes, they revolve around that. But also there are others that will tell you that if you don't have anything to do in a public place, stay at home, so that you avoid most of these things when you are alone. So that is another thing. And also when you go to a public place, limit the number of hours you take where there are so many people. That one you are also saving yourself. And what people need to know is with this COVID-19, and I said earlier, we do not know who has the virus or who does not have it, because 60% of our cases are asymptomatic. So anybody could be having it. And when we put on a mask, if I put on a mask myself, this mask, then I will be preventing my droplets from coming to you.
Okay.
So at that point, I'm protecting you by my mask.
Okay.
Others think the opposite. But then now you should put on yours so that you also protect myself from your droplets.
Okay, we have to wind up. I'll welcome your parting shot, especially on the fact that the experts are saying if we do not flatten our curves as nations, then we are prone to seeing our hospitals collapse. But Kenyans and people are asking, for how long do we continue putting on the mask and with this lifestyle? Should it be a lifestyle? Yeah, as we wind up.
Yeah, it may be a lifestyle, it may not be a lifestyle, depending on how our behavior could change. Because again, with this period, if we have to go to crowded places, then we must have the masks on. Yeah. If we want to help ourselves and prevent the infections from getting into us. We have seen, and I would encourage the general public to embrace the preventive measures as much as possible, because they are easy to do and they cost you nothing. As far as we are concerned, when we compare with the other side of the story. And now that our hospitals are also having some breathing space, we do not want them to be overburdened again. So we must invest heavily on public health, because that is where the prevention lies. If we don't invest on public health, if we don't train and support these people who are working at the community level, then we will still have the scenario of hospital systems being overwhelmed.
All right.
Yes.
Gamaliel Omondi, thank you so much for your time. It was important to remind one another on these preventive measures that may look simple but crucial in the fight against COVID-19. Thank you for your time, and God bless.
Thank you very much.
All right.
And God bless you too.
Thank you all for watching Family Matters tonight. It's been great having your company from 9 p.m. to this hour. My name is Purity Museu. Byron Abuli has been our sign language interpreter tonight. Do enjoy the rest of our programming and the next week, of course, the coming week ahead. Bye-bye and God bless.